To get started. But hello, welcome to Time to Process. I have a very special guest with me today. This is Dr. Elise Mecham.
Hello.
She is a plastic surgeon, reconstructive plastic surgeon, I guess I should say. What's your full title? I don't know if I even know.
So I do everything. So it's my actual title is microvascular reconstructive plastic surgeon, but I do complex reconstruction and I do cosmetic surgery.
Okay. See? Guys, I tell you, I have the best people in my life. Okay, we have a fantastic connection, you guys, because my oldest son is actually a stepson, and this is his mom.
Hello.
I know. So we get to share, Gabe, and it's amazing.
It is amazing.
It really is great. We have a great relationship. I do her hair. We like all the things.
It actually took me extra time to get ready today, although you can't tell because it's like, she's going to see what I do with this magic she does, and she'll be disappointed in me. So just so you know, we're late starting today because I had to straighten out and blow dry my hair.
Make sure you look good. You always look good, though. You do, but you have great hair. So it's easy to
I have a good hairstylist.
I will. Your color does look amazing. I did notice when you came in today. But your hair just like naturally just like, I don't know, it just like blows out well. It curls well. Like you do have great hair.
It behaves.
It behaves. Good. That's a great word. That's a great way to say it. It behaves. Okay. So that's, like I said, kind of a quick introduction on her. I've known her literally for almost 19 years.
Yeah.
Since 2005.
Yeah. Yeah, it's been a long time.
Wild.
I know.
Yeah, 19 years.
We're not admitting to that.
I know, because we're not that old.
No, there's no way.
We can't handle it. I look back and I'm like, where has the time gone? Literally, where has the time gone? Because I feel like Gabe was 5 yesterday. Like,
oh my gosh.
It went so fast. And now he's almost 24.
Yeah.
Oh, I can't handle it. Anyway, so that is how I know Elise. So tell me a little bit about you. Like, so even down from like, okay, you always have multiple other kids.
Yeah.
But you maybe even like a little bit about your schooling because you started at UVU, then went on to the U.
Yep.
Yeah. Okay. Tell me about that.
So I think the role that that brings me the most joy and that I'm most proud of is definitely mom. I have 5 kids. I have a set of twins. Courtney has a set of twins.
We also have, that's what I mean. Guys, we're connected in so many ways.
Hers are fraternal, mine are identical. Mm-hmm. So Gabe is a big brother to 8 between the two of us.
Wild.
So that's the part that I like the best. But so undergrad was Utah Valley University, UVSC, actually, that long ago.
Yeah,
it changed over the year I graduated, so my diploma says UVU, but it was technically UVSC.
I didn't know that.
Yeah, my dad helped the university get university status.
Yeah.
And so those of us that graduated the year they transitioned our diplomas all say UVU.
Then they did it. Mm-hmm. Oh, that's fantastic then.
Yeah. Kind of weird. It didn't matter.
Did you just do one undergrad? Did you do 2? I thought maybe you did 2
so
bachelors.
I started in English and just about finished in English, and then I transitioned into biology and chemistry.
Okay.
So kind of a big change, but my mom was always very into grammar and language. She wanted to be a lawyer, and so and I was really into writing at one point. So if you need your papers corrected, I'm the worst mom ever.
I know. I'm terrible at grammar.
I know. I have a hard time not sometimes correcting my cute little employees, and I'll be like, don't say that.
Yeah.
But so it's biology and chemistry at UVSC or UVU, and then I went to the University of Utah for medical school. We were there for 4 years, and then I went to Texas for residency at the University of Texas. We were down in Galveston, so they said UTMB medical branch. And then after that, I did a year of microvascular reconstructive fellowship at MD Anderson. And so...
that was at a different hospital.
Mm-hmm,
I don't think I realized that either.
Yeah, so MD Anderson isn't as well known as some of the bigger names, but they alternate with one other hospital in the United States as number 1 for cancer treatment and reconstruction in the nation.
So that's very cool.
It was a big deal. Yes. My other choice was I was leaning towards Stanford, but the cost of living in Stanford would have been... My kids would have lived in Utah, and I would have rented a hallway. So we'll just stay where we are.
We're sleeping in closets.
Exactly. So we stayed in Texas for that, and then after that, came back to Utah, where I worked with an amazing group of general surgeons for a while, the Utah Surgical Associates. some of the best surgeons and people you will encounter, and they're here in Utah County, which is
Yes.
phenomenal.
Phenomenal.
It's unreal.
They are fantastic.
You would not believe the quality of medical care in this county.
Yeah.
But as of now, I went out on my own about a little bit more than a year ago, and I own a company called Real You Plastic Surgery and Wellness, and we are really focused on the wellness aspect as much as we can be, where I do a combination of cosmetic, hormone therapy, weight loss management, and then the thing that I really love is the breast cancer reconstruction. I also do, if I get called, I'm the only microvascular fellowship trained person in Utah County. And so,
okay, I didn't know that either.
Yeah. So if you have a limb that needs to be salvaged or a trauma that needs tissue, I'm your huckleberry.
Yes. She's our
super
gal.
Sexy.
Yeah, but I mean, I've talked to you about her before, but my cute little friend Lauren Messnard that lived in my neighborhood, but she is she wants to be a medical examiner.
Oh,
the one that wanted to, anyway, come and shadow you. But yeah, just talking to her, and she's actually working in the ER right now.
Oh, very nice.
Anyway, it's just wild how you guys like not even are like on board with that, but just like it doesn't bother you. Like you can handle that. Like I feel like I can watch things on shows, but I don't know if I could actually see it in real life and be like, okay, let's calmly take care of this.
I think it does a few things. One, I don't know very many surgeons who enjoy horror movies.
Sure.
Because I think we
deal with it in real life.
Yes. Yeah, exactly. So I used to watch one really scary movie every year. Now it's gotten to the point where I start to get into it. I'm like, nope, too stressed. I just turn it off. So you will never catch me watching a horror movie these days.
I can't either because I just am terrified. I have nightmares.
Yeah. And then I think the other thing is, I train people. I take med students. They always send the new scrub techs, which are the people that hand you instruments in the ORs, into my OR.
Yep.
And the reason for that is I'm not mean. So I come in and we train, and it's really common when you're first starting in training that you have a time where you see something that all of a sudden stresses you and you think you're fine, and all of a sudden the world around you starts to blacken at the edges and you get hot and sweaty, and it's called a vasovagal response.
Okay.
And it is common to have that happen especially when I'm doing things like I do liposuction for cosmetics and for breast cancer, but it looks really intense when it's happening.
Yeah.
And
I've seen
those cute
only reality shows.
They get lightheaded and you have to make them stop and back off and take a break, and then usually they can come back. And once you go through that, you realize you're okay, the patient is okay, and then you're able to start processing differently. But I do think there's a little bit of compartmentalization that goes on.
Like you feel like you almost have to kind of learn to handle things.
Absolutely.
It's not like you just handle it.
The first time I saw a rhinoplasty, I got sick. I was like, oh, I'm gonna lose it, y'all. Like chisels in your nose are not something that you commonly see.
Yes, like a
it's and that's really I'm like, why did they have a hammer right there? Anyway. Yeah.
Oh my
you do adjust over time.
Okay. But I feel like you're right, because I would not think that. I would think it just takes a special person to go into that, which
probably
you're right. It's probably a mix.
Yeah.
But I think anyone, could probably get used to it, or maybe back off, take a minute. Yeah, that's interesting.
When you feel like your role is needed, then you feel like you need to step up.
Sure.
Does that make you like, okay, I know that I got kind of queasy last time, but I know that patient's okay. I'm gonna get in there and I'm gonna rock it this time.
Yes.
And I think there's a feeling of almost not obligation, but like a calling to be like, okay, this is my role. I'm gonna be really good at this. Yeah. So
I actually love that. I think I think you could 100% attribute that just to life in general, right?
Exactly.
Like these people need me in whatever capacity. So I've got, even though if it's something that makes me nervous or this or that or the other, then you can absolutely be like, no, but I have to do this.
Yeah.
Like,
need to step up.
Yeah. You have to step up.
We did skip something though.
Oh,
I want to hear what your favorite 5 are.
Oh, yeah. We do need to get to that. Sorry, I get distracted.
I do too, but now I'm like, what is this?
I know,
what
I
are
do.
Courtney's
Yes, I
favorite
do.
5?
But really fast, I do have to say, we are really going to focus on, because it is Breast Cancer Awareness Month this month. I didn't say that at the beginning either. I was like getting too ahead of myself. But that is one of the main reasons why I wanted Elise to come on the podcast because she really does specialize in a lot of that kind of stuff. But yes, let's hurry and do my 5 favorite things. You're right. I was like getting ahead of myself because
now I'm curious.
I do love to listen.
Because if Courtney likes it, we probably all need it in our lives. I'm just saying.
I do agree with that. No, it's so funny because my friend that I had on last week said the same thing. My friend Haley. But these ones this are a little bit different, and there's some you may know and some that you may not know.
Okay.
Okay, and I have to like always preface this because these are things that I just feel like I have enjoyed forever. They're not specific to one niche. They're not like all makeup, all this or all that. They're kind of random stuff. So this first one is very random. Ranch dressing.
Ranch dressing.
Ranch dressing. Okay, I know.
I'm ready.
Work with me here. So we all love ranch dressing. I feel like I grew up in a family who they literally eat ranch on everything. But my mom found when I was like younger, there's literally a bottle of the mix. So it's like a dry powder mix.
Yeah.
From someplace in Idaho.
Oh.
So you can't buy it anywhere else. You have to buy it literally online and they'll just ship it to you and you buy multiple bottles at a time to save like on shipping. Yeah. So I have like multiple friends that I'll do it with. But I feel like with ranch, if you buy it in the bottle, it's usually too like kind of buttermilky.
Yeah.
Or I don't know, it just doesn't ever taste good.
Yeah.
I feel like the same when you go and eat at like Buffalo Wild Wings or anywhere that's supposedly supposed to have like a really good ranch.
Yeah.
It is not good. Like, I don't know. It's just like not good at all. Not my favorite. And so I had just recently put in an order and my friend and I were talking about it. And I was like, I got to put that on there because I've literally bought it for years. And what you do is you do like a half or a cup of buttermilk, a cup of mayo, and then just the ranch stuff.
Oh, okay.
And that's it. And then you shake it up. I put it like in a blender bottle.
Awesome.
So it has like the little metal thing inside, that shakes it up. But it's so good.
What is
like,
it called?
So good. So it's called Spice West Ranch Mix.
Spice West. Okay.
Yeah, that's it. So I'll do the link. I'll put it like in my stories, but it's so good. I think it's just a family-owned company that they've been at it forever. Awesome. And it's just like the perfect amount of buttermilk and the flavoring and everything. It's just, I would say like as close to what a ranch-based flavor should be, right? Without being like too, like I said, buttermilky.
How long is it shelf stable? The powder, the mix. I mean, is that something you would want to put in like food storage if you're into that stuff?
Sure you absolutely could.
Okay.
Yes, 100%.
Awesome.
You're right. And because that's the thing too, is like you think about like you can buy packets of the ranch stuff at the store.
Yeah.
And you can use that like when you do roast or like I make that Mississippi roast.
Yeah.
We've talked about that. I think you've done that one too. But
yeah.
But I use this stuff instead of like the ranch packet so it's literally for anything that you would typically use a ranch packet for. You can put it in just sour cream and use it to dip chips in.
Okay.
Or vegetables or anything like that.
Okay.
I know. It's so good, you guys. I told you it's a very random thing, but it is so good. So good. Okay. The next one is, have you heard of an Instagram called Home and Kind?
No.
Okay. So she is amazing. Her name's Brittany. I've met her a couple times now with my friend Tierney because they're actually like friends. She lives in North Carolina, but she does cookbooks.
Oh.
But they are the like one-stop Costco meals. So everything in the entire book is all stuff you can find at Costco.
Oh, that's awesome.
But it's obviously stuff you can find elsewhere. I make her recipes all the time, but I don't really shop as much on a big scale. I'd rather do it just week by week and get what I need. Every now and again, I'll do bigger stuff, but there's one that's a hamburger slider. Ooh. That you cook up the ground beef first. You like put a few things in it, and then you do like cheese, and like then you put butter on top of the roll. Like it's almost like an enhanced hamburger, but it's not a patty. It's ground up. It's phenomenal. It's so good. It's so good. And it's one that like my kids love. Anyway, so she has multiple cookbooks. She has one that's all Trader Joe's.
Oh.
So everything from Trader Joe's. And then she just released one. We actually went to her book signing this last week at Riverwoods. She did one at called To Surf.
Yeah.
And it's school lunches.
Oh my gosh.
An entire cookbook of like to put in like bento boxes or to do like in the little Tupperware things. You can do like taco salads or this or that. It's genius. Like I didn't even realize that she was doing it. And when Tierney was like, hey, do you want to come to this book signing? I was actually thinking it was the Trader Joe's ones. I didn't realize that she had already put that one out and had a new one. And then with it came lunchbox notes.
that you leave in the boxes
yes,
for the kids.
but you don't even have to write on them. They have
Oh.
jokes on them. They have like cute quotes, like very, very, very sweet. So Home and Kind is what her Instagram is. But yeah, the cookbook, I mean, we've used lots of things. There's another recipe we just did this week that was a pesto bruschetta chicken.
Ooh, yeah.
And you marinate the chicken in the pesto.
Oh, that's awesome.
I never even thought of that before. It was phenomenal. Like it was so, so, so good. So, okay. So that's my number 2. See, I'm kind of all over the place. Ranch to recipe
so far,
books.
it's all food related.
I know.
Which
this
I
one
get.
is not. This is body wash. Okay. So I love, and we've actually, you and I have talked too, like when we've done hair, Moroccan oil.
Mhm.
Everything Moroccan oil smells amazing. And they have a body wash that smells just like their like shampoo and conditioner and their products. It's so good. But it's like that perfect mix where it's not like just for women. Like,
okay.
Like my husband uses it. Like we just use it in our shower because it is more expensive for sure. But it's also is it called concentrated? Where it's like a thicker, so you don't have to use as much.
Okay.
So yeah, it's more of like a concentrated or not substance, but what's that word? Like consistency.
Yeah.
Anyway, it's phenomenal. It's so, so, so good. And I don't know, it's one too that I feel like is like, I've actually given it away to lots of friends, like just as like a cute birthday gift or like I don't know. I just feel like when I give gifts to people, I want to kind of do something different than just like, here's a cookie.
Yeah.
Or here's, do you know what I'm saying? Like a little something. I'm like, here's some body wash. Maybe that makes me the weirdo, but I am like, that's something that you would not expect. And it's something that you're like, oh, that, again, the scent is so good and so clean. I feel like it's a really clean scent that, I don't know. I love it.
You know, when you're giving somebody your favorite something.
Yes.
Right.
Yes.
And it's an opportunity for them to pamper themselves, which I think is a little bit better than a cookie.
Yes, so. I totally agree with you. Yes, because it lasts a lot longer too.
It's true.
Okay, and then my next thing, speaking of my friend Tierney, she actually gifted me this for my birthday, and same, it was like one of her favorite things. It has very quickly become one of my favorite things. So it's a makeup bag, and it's square, has a handle on it, which I love to be able to carry, but it has like a hard outer shell. So you know how a lot of times when you're like trying to do your makeup and you can't find anything in there because it's kind of folded inside of itself. Yeah. So this has a hard outer shell and it has compartments. So you unzip the top, almost like a mini luggage or like suitcase.
Are you old enough to remember the caboodles?
Oh yes. 100%.
So like almost like a
kind of, but still like soft on the outside.
I love it.
But then like a little bit of a hard shell on the inside.
Very clever.
Yes. So it's fantastic. And on the inside, there's like a Velcro flap. And when you open that, it has spots to put your makeup brushes in. So they don't get munched
like all gross
on the inside.
And,
yes, with the rest of your makeup. So I have like a compartment for like my blushes and then one for like my foundations and one for, it's
Very
cool. When I obviously post about it, I'll show pictures and how it all works. But it's fantastic. And it's like a good enough size too, where it's like you can put it in a travel bag to travel.
Okay.
Or it's easy enough to like, oh, if I want to like take my makeup with me to like touch up after doing something. Yeah. It's quick to like grab and go.
I think that's my biggest complaint about makeup bags is they're always either way too small or they're enormous and I can never find anything in them. So I'm like, I know I have that little pair of tweezers in here, but I may never be able to find them again.
Yeah, totally. Or like the pencil sharpener for like a lip liner or something like that. That is like so frustrating to me that I'm like, it has to be in here somewhere.
I know.
There's not a hole anywhere.
My bag
I can't see. Yeah, exactly. I'm like, I have no idea what could happen to it. But yes, so it is so, so, so good. And it's kind of one of those, when she gifted it to me, I was like, oh, this is so cute. I don't know if I'll really use it as much, but I use it every day. That's awesome. It has my everyday makeup in it. So it's so, so cute. Okay. And my very last one is also very different. But Nerds gummy clusters.
Okay.
Oh my gosh. I feel like I love them for so long. And then I ate them so much. I feel like I was kind of over it.
Yeah.
I have reignited the love because we had ended up buying some treats for like the kids to have friends over one night or something like that. And that happened to be a bag that like didn't get opened.
Yeah.
And so we had opened it. Anyway, they're so good. Why
They're
are they
so
so good?
satisfying.
I don't know.
I don't know.
Is it like because they're a little bit of that like licorice taste in the inside plus the nerds? But don't you remember when we were younger growing up, eating nerds was like kind of cumbersome because they're like
They
such a
rolled everywhere.
Yes, they rolled everywhere. You couldn't like put it in your hand and like shoot it back like it was, or you buy the box, you had to like slide the tab over on the top.
And if it got wet, they all stuck.
Yes, they all stuck. Yeah, you couldn't like put your spit on it at all, or else you're screwed. I know. So yeah, but I'm like, okay, I have reignited my love for those, and they're the perfect amount of sweet and sour, and yeah, they're just so good. I don't know. I love them. Okay, that's my top 5 favorite things of the week. Every single week, I love it. I never run out of things to find. So,
I have to think about it.
This sweater is to die for, you guys. I keep telling you how freaking cute it is. I'm just excited to actually get to sweater weather.
I know. Well,
because right now in Utah, you guys, it's like 65 in the morning, so it's chilly when I go to the gym.
Yep.
And then I dress for chilly, and then it's 95 degrees when I leave work at 1:00, and then at night we're at the football games at 6:30, and I'm like, it's frigid now again.
Yeah.
Like the wind starts picking up. Anyway, it's the worst. We have like all the seasons in one day, and it's terrible. So anyway, I'm excited to get to sweater weather. But okay, I just want to get into it. So kind of what I told Elise when I was coming, asking her if she would come on the podcast. Because like I said, I wanted to do breast cancer awareness. I wanted to really play into this, the theme for October. I am wearing my pink shirt today. It's the only pink shirt I own. I know. And I should have said something to her, but I didn't even think about it. But I just wanted, how did you get into the breast cancer realm?
That's a good question. So it was back in med school. I was leaning towards trauma surgery instead of plastic surgery. I kind of have a mentality or a work ethic that there are jokes in medicine about your subspecialty, like, like the ortho guys are always the bros that go work out, and yes. Internal medicine are like the Harry Potter nerds. I'm actually a Harry Potter nerd. Sorry, guys. But I mean, it's just kind of funny. There's like, you're kind of grouped into what you're going to go into based on your personality. And it's funny because plastic surgery is usually the group that are like, yes, I'm going boating this weekend, but we'll do a humanitarian mission to make up for the fact that I own a yacht. Turns out I'm not that personality type either. So I was going into trauma surgery because my personality does kind of lend itself to that. And I had a couple of friends that matched into plastic surgery. So if you're familiar with the medical world, you know that we actually never have control of our lives. And so when you are choosing what specialty you want to go into, you actually throw your name into a computer algorithm based on the subspecialty you want to apply to, and the computer will decide. You interview at different places, and then the computer will match you to whatever program. So you don't actually just get to choose and be offered a job. So they matched into plastic surgery, and they were the first 2 in several years at the University of Utah to go into plastic surgery. But they were 2 people that I had a lot of respect for. I went to school with both of them. They were the year ahead of me. One of them was my tutor in anatomy, and the other one was just a really kind, good person. And you've probably heard of one of them. Jerry Chittister is one of them. Mm-hmm. So he matched. And yes. Another good friend, Sean Mendenhall, and both are extraordinarily wonderful, talented surgeons.
Wait, is Mendenhall around here?
He was at the University of Utah. He's hand fellowship trained. And so he was at the University of Utah. He left, and now he came back.
Okay, so I feel like I have heard that name recently.
He does pediatric hand.
Oh, wow. Yeah. Maybe that's why. Okay.
Yeah.
I have another story.
He's a rock star.
Okay.
He's
amazing.
He's a gentleman. He's wonderful. But I remember coming up to him and I was like, guys, you just matched into plastic surgery. Yeah. Where's your moral compass? You're going to do TNA for the rest of your life? Well, I mean, you went through med school for this? And you were like, if that's what you think, you probably ought to rotate with us and see what it's really about. And so in med school, I wasn't entirely sure what I wanted to do when I went into it. I went into it thinking pediatric cardiology, which is a far cry from where I am now. But I went into it also thinking, I'm going to try on every one of these opportunities like it might be the one.
Yeah.
And the only one I did not like, and I'm sorry, Mary Claire Haver, she delivered my twin. She's lovely.
Oh, yes.
But I did not love OBGYN. I have never met more angry residents than an OBGYN. I was like, I don't want to be one of these people. So
because
every
you're
one of them.
literally dealing with angry women.
Oh, they
They're
were
like, get
so
this baby
angry.
out of me.
Yeah, the residents were angry, and I
Yeah.
was pregnant at the time, which may have been why
Yes,
they were probably like, "Oh, here's work for us," right? But I remember just thinking, "Oh, this is the one field where I would love to be part of that, but I just don't. These personalities, I don't jive." And so I rotated with Jerry and Sean, and I did a week in microvascular surgery doing breast cancer reconstruction. So what that means is I take tissue from one part of the body, I find what blood vessels supply that skin and fat or muscle or whatever we need, and I dissect those out, and then I disconnect that piece of tissue, and then I hook it up into blood vessels in a different part of the body using suture finer than a human hair and a microscope and these beautiful instruments that are just they're gorgeous, but they're literally microscopic. And so when you're using these things, like they get damaged and bent really easily, and they're really expensive. So hospitals love it when people are rough on the micro instruments. And I loved that. And what I loved about it wasn't just the extraordinary level of skill that it took to be good at that. It was that on that rotation, we had general surgeons coming to us and saying, I can't fix this. I need you to fix this. We had orthopedic surgeons coming to us and saying, I've got an exposed tendon. We can't get it to heal. This patient's going to have an amputation unless you can come up with a way to solve this. I mean, it was extraordinary to be with the people that had to fix things that the really good surgeons in other fields didn't have an answer to.
Do you feel like it was like because it was a challenge?
Well,
or is it more just like, this is just such a cool thing to be able to do?
I think it's both. So I've never been the one who took the easy route, as you're well aware. If it's the hardest way to go, it tends to be the way I like to go. But it's even more I think it's the combination of the fact that that you, by definition, have to think outside of the box. So instead of following an algorithm, I have to blaze a new path, which I love. I love that about medicine. I love that about surgery. I love that about wellness. I love looking outside of the normal purview. I love pulling data from, PubMed or other countries and bringing it all together and saying, oh, this is the big picture. Here's what I can do with that. And so that's like a fun thing for me. Sure. It's like people who like math. It's like solving a puzzle for some people.
Totally.
This falls in that category for me.
I'm not one of those people.
That's okay. I didn't know that I was
let's come up with an easier way to get this done.
And so I think what really drew me is I had this idea. I remember when I was young, I shadowed one of the surgeons down in Utah Valley Hospital who is truly what we would call a surgeon. So that's a reputation in medicine where even the surgeons take their family members or themselves to that surgeon because that's who they trust.
Oh, interesting.
And I remember my dad mentioning to me as I was shadowing this particular doctor, he's like, this man is a surgeon. And I was like, I'm going to be
that person,
a surgeon. Yeah. So I was 7 when I knew I wanted to go into medicine. And I remember even back then, my dad talking about this person who was a family friend of ours. And so in case you're wondering who that is, his name is Craig Cook, and he would die if he knew that I was saying, because he's so humble, but he is extraordinary. And I thought someday I want to be like Craig. Yeah. Of course, back then it was Dr. Cook. But, and I remember being in plastic surgery and thinking, well, I can't be, like Craig Cook in the sense of being a general surgeon if I go into this. But this to me felt like the next level of being a surgeon. So being excellent at what I do and taking that skill set to a level that, at the time even didn't exist in Utah County.
I was just going to say, I feel like the only plastic surgeons I knew or ever had heard of was just cosmetic. Like growing up, like I didn't even realize maybe like, if someone had like slashed their face and you had to go see a plastic surgeon, but I feel like nowadays, like you guys are a part of everything. Yeah. Like to me, you know what I mean? Like, I don't know, all sorts of scars and like things that just like, even if you had to take like a lump out of your back or something, it seems like nowadays you don't go to a general surgeon for that. You go to more of a plastic surgeon because of the delicacy you guys put into your stitching and all of that.
Yeah, a big part of our training is scar reduction, minimizing scarring, maximizing healing.
Mm-hmm.
We're your wound care specialists. We're the people who you come and see for a problem that other people haven't figured out yet.
Yeah.
And I think there's an element of people are starting to realize that, there is cosmetic surgery. I mean, the people that you hear about the most on the internet are the big cosmetic surgeons, right?
Yes,
to be fair.
Yep.
But there's definitely, we're the people that we do we do trauma, we do not like running a code trauma, but like reconstruction. Breast cancer is a big part of what we do, limb salvage and burns. So when I first came back to Utah County, I did want to ask
about that too. Yeah.
I approached Utah County and I said, Utah Valley Hospital, I was like, hey, do you guys want to set up a burn unit here? I'll help you, because I did about the equivalent of a year of an acute burn fellowship and a year of a reconstructive burn fellowship where I trained. So I was like, I'll help you guys get this set up and run it with you.
Yes.
And they didn't want it at the time. And I was like, great. Fine, then I'll stick to my micro. And I'll set up micro at a couple of hospitals around the county where I do microvascular surgery. But it's what plastics does is so diverse. It's just most of the time that's kept at an academic situation because it's really hard to produce in private practice doing those things in plastics.
Yes.
Because if you're not at an academic institution, insurance-based plastic surgery is kind of the redheaded stepchild of medicine.
Sure.
So
yes, I would feel that as well.
Yeah. That's who we are, and that's okay. Most of us know that. So.
Yeah. Okay, so once you started down that road, was there someone that you came in contact with, or like because you obviously knew like breast cancer was always something that you would be in conjunction with plastic surgery, right? But was it because does Chittister do anything with breast cancer type stuff?
Not for insurance.
Okay. But just more cosmetic wise. Because I guess it's just like, why did you choose that? Why did you say like, hey, I actually really would love to focus on that? Because you are someone who is, I would say, well known for the breast cancer, avenue in Utah County.
Well, so I think part of it is I know I wanted to come back and work with Utah Surgical Associates, right?
Okay.
I knew I wanted to work with people like Craig Cook and some of his partners. And as I was going through residency, I went into plastics, and for a while I felt a bit like a fish out of water. I mean, I do a ton of cosmetics.
Yeah,
absolutely.
Yes.
But I love it. But at the time I just felt like, there was a little bit of like what I went into medicine to do. I felt like I wasn't fulfilling that calling.
Sure.
If that makes sense.
Yep. Yeah. You needed more out of it. Yeah. That makes sense.
And as I was looking at Utah County, I realized that there were a couple of plastic surgeons doing breast cancer reconstruction here, but there was nobody here doing advanced reconstructive techniques at all.
Oh.
So there was no one doing flaps.
Okay.
They would only do implants, and sometimes that's not the right answer.
Yeah.
There was nobody doing lymphovenous and lymphatic surgeries and by the way, I'm not doing those right now. I got shot down by Intermountain at the time. Now they're starting to do those things, so we're trying to open that up down here. But
I don't even know what that is.
I know these advanced reconstructive techniques. Yeah, were not available to the ladies here.
Interesting.
Yeah, and so and I knew that I wanted to be trained in something that would have a profound impact in this county.
Sure.
So then I did another rotation. I did it at MD Anderson as a resident. And as I went into that rotation, I was like, oh, right, this is where I feel at home again. So I found my footing and I was like, this is the direction.
Oh, I love that.
Yeah. So I joined Utah Surgical Associates and, started doing microvascular, and it was an uphill slog for a bit because they didn't have anyone doing it.
Sure.
And I've just always felt like, the reason I came back to Utah County was because there's a community here that has a need.
Yes.
And so that was a need I was willing to step into and fill.
Well, and isn't Utah a pretty big cancer base, like with John Huntsman and all of that, or not really?
I mean, so most states have some, not most, but a good portion of the states have some kind of a cancer hospital.
Okay.
At least the ones that I've been in.
I guess I just don't, I just don't know enough to, so maybe that sounds ignorant asking that. But
no, not at all.
It just seems like when people talk about those around you having cancer, it's always like, oh, like there's the best people in Utah County and Salt Lake, right? That like
they are.
For any type of cancer. So that's where I just wonder if it's do people come to Utah instead of maybe being at another state or in another state for that? Well, or do you even know?
Yeah, no, that's twofold, right? Okay. So, one, I don't know if our cancer rates are higher here compared to anywhere else. That I think that there probably is a little bit more of that. We've had nuclear testing grounds here. We have a lot of mining that goes on in Utah and that releases stuff into the environment. But what I would say is that one of the reasons I believe that we have such an extraordinarily trained force of physicians in Utah County for that is because people want to live here. It's the same reason we have such a plethora of well-trained plastic surgeons, right? Utah is a medical tourism state. The cost of plastic surgery tends to be lower here because it's competitive, because we have really well-trained plastic surgeons throughout the state that want to be here. And so people come here from California, from New York, even though there are great plastic surgeons in between, the caliber versus the cost here is actually pretty extraordinary. And so that's part of it. But I also think that, like in Utah County, we're not necessarily like a cancer institution like you would have at Huntsman. But you have people from Mayo, Stanford, Harvard. I mean, the best
all the big names.
Yes. Beautifully trained people who are here doing advanced care. But what I have found is that people here in Utah County are here because they want to be here and they love the people. And so like our breast tumor conference, I've never heard, and I've now done this at several academic institutions. When they talk about their patients, they talk about them as people. It's pretty extraordinary.
Which is huge.
Yes. They're like, okay, this patient lives in Duchesne County and she's got to come here for this treatment. She's 80. What do we need to do to maximize her treatment but minimize the disruption this is going to cause to her life? And they talk about the social situation, the tumor markers and things like that. And I think the reason we have this group of people is because, one, when you start to collect extraordinary doctors, more come because they know they can provide the care they want to provide. So I'm like, I've got people here that know more about melanoma than some of the people at academic institutions, and that's who I want to talk to.
And absolutely.
So I think it draws a group, and then I think the people who are here, we want to be here.
I actually love that answer, and I feel like that is totally spot on. Like it may not be like a specific hub for it, but it's the people, and I feel like they genuinely care. Like they are doctors who you're not just a number to them. You are a human being. You're 100% a person to them and a friend. I mean, don't you feel like that with most of your patients? They're friends to you now.
Some of them become lifelong friends. Not all of them. I mean, some of them are like, Dr. Mecham, I loved seeing you for the past 2 years.
But I don't ever want to see you
sayonara. And then there are some who are like, they've changed my life and I've changed theirs. And so, when you're going through that experience with someone, it's like, I don't even know how to describe it. It builds a rapport where you become kind of a lifelong part. They've gone through trauma and they've healed, and you've been a part of that journey. And so it's
like a little bit like maybe trauma bonding. Maybe,
except hopefully not
in
exactly.
a bad trauma. Not in a bad trauma bonding, but like I feel like just when you've gone through something and then somebody else has also gone through the same thing, I feel like you feel maybe a kindred spirit with them.
Absolutely.
Right? Where you're like, and not necessarily that you've even gone through that, but you've watched enough people go through it and you've been right there with them step by step. So you feel that like, like you're kindred spirits with them, or like just this bond that you wouldn't have normally.
I think a good part of it is to being a female. Like, I understand what it's like to have a mammogram scare or, what I feel like if they were telling me I had to cut off my breasts, right? These are things that make it so that it's easy to have empathy. And I think also being female makes it easy to not be afraid of emotion.
Totally.
So my patients come in and they're crying and we're going to sit together. That's just, sometimes the wait is a long time. Sorry, folks, the wait can be long. But the reason for that is there are days when patients just need you to be present.
Yeah.
And I think it's easier to do that having grown up in a situation where women are allowed to be more in tune with their feelings, right?
Yeah.
And so I can sit there and we can cry if we feel like having a bad day or whatever it is. And I think that's kind of the difference between when they come into my office versus someone else's. And again, the people who do reconstruction in Utah County are good. So this is not a dig on any of them.
Yeah,
but
for sure.
I just think that's what makes it a little bit different when you're walking into an office that's run by women and you've got a problem with your breasts or whatever part of your body. You don't like your abdomen after a baby, or you've got diastasis and the men are like, it's fine. You look fine. And you're like, but no, I need something
actually,
fixed.
I don't feel like I look fine.
This is not how I want to be. And I'll be like, I think you look beautiful, but I can see why you would be concerned.
Sure.
Let's see what we can do.
Yes.
So,
yeah. She is very good at that, because I have been in her office before, and she does make you feel like you're the only patient in the place. And answered all the questions. And I don't know, I do think you're very good at that. I've told you that before, but I do love that about you, and the fact that you are a woman. And I've told many people about you as well because of that reason. Like, people are like, well, why go to her versus somebody else? I'm like, because she's a woman, and there is other women plastic surgeons in Utah. But I don't know, I feel like when I would describe something, you were like, oh, I understand that. Like a man could be like, I understand. I'm like, no, you don't. You've never had breasts. You have no idea. Yeah, totally. So I do appreciate that about you, because you are very, very good at that. Okay, I just wrote down like a few questions, guys, things that I wanted to maybe go through. But okay, what do you want to tell people about breast cancer and how to watch for it?
Yeah, so I feel like there's been a shift in the demographic. So one thing that I would say is, if you're worried or you feel a lump, don't allow your doctor to say, oh, you're too young.
Yes.
Okay, so recently I've been seeing younger and younger patients in my office. And one thing, by the time they get diagnosed, because they're young, they've been blown off. And one thing that I would absolutely say is that if you're worried, be an advocate for yourself. If you're worried about it, then you want to tell your doctor, no, I really think we should get that mammogram. Or, no, I'm really worried about this. What do we need to do to work it up? Don't let them say, it's okay, you're too young.
Yeah.
I have patients that range in ages from 23 to 80. I mean, which is wild. It is wild.
23. Are you seeing with those younger ones that there is a family history of it, or no, not all the time?
It can be. Okay. I mean, a lot of times we're seeing that there are genetic mutations that make them more prone, like CHEK2, BRCA1, BRCA2, some of those different things. Sometimes there's not. And there's a lot of things that I could speculate that could be causing this increase in younger breast cancer patients. Some of them are very subtle. So like forever chemicals in our clothing, like PFAS in our favorite workout clothing, or our underwear. Like, why do we need those in our underwear? Get some organic cotton underwear, ladies. Organic bras.
Interesting.
Take away the stuff that's synthetic and try to start rotating that out of your day-to-day wear, and do that for your daughters. A lot of it can be that we have a lot of synthetic scents that are hormone mimickers. So make sure you're going for organic. There are organic like perfume companies and things like that. I read a study that was talking about, how many harmful chemicals are women exposed to just in their day-to-day routines. Yeah. And it was more than 120 harmful chemicals before you left the house in the morning. Like, that's a lot.
That is 100%. Everything I've probably said on my favorite things list is probably.
I'm not going to say anything, but I mean, 120 every day.
That's crazy.
And at some point, your body is going to get. It's going to be more difficult for it to clear those things, right? And so we're going to start seeing more of those side effects.
Yeah.
So those are some of the.
That is really interesting.
Yeah. So things that we've started doing at our office, like we carry a mix of skincare lines. We have all your traditional favorites, and then we have organic types of stuff. I have a friend of mine who was a breast cancer patient, but has become a best friend over the years, and we're starting to make tallow-based skincare lines.
Oh, okay.
Things that are high in vitamin A, which we know is good for wrinkles and aging. Yeah. But then we only use certain types of additives. We minimize even some of our natural plant-based stuff can increase our estrogen levels, right? And those plant-based or not or synthetic type of estrogen mimickers are things that drive that breast cancer risk.
That is
So
fascinating.
one,
I mean, I feel like I kind of knew some of this stuff, but
totally, but it's like all of a sudden you put it all together and you're like, oh,
yeah,
I should have been thinking about it.
Yeah.
I know, right? I know, and I'm not perfect, so please don't take this as a lecture. It's what can you do a step at a time? How do we
Well, I think
start to minimize risk?
How do we be better tomorrow than we were yesterday?
Exactly.
For sure.
Exactly.
For sure.
So things that I would say,
Okay.
the standard recommendation is mammogram starting at the age of 40, and then every
Okay.
1 to 2 years, depending on which college you're reading after that. And I'm fine with that as well. It depends on what you want to do, but if I would say the biggest thing is if you're worried, don't be blown off.
Just go.
Exactly. And then 2, start looking at what you're putting on and in to your body and start now. So what can we do with our clothing? There are organic workout lines. There's, and I'm not paid by any of these people. So just so you know, but there's a brand called All Wear that's supposed to make rockin'. I haven't even purchased them yet myself, but I've got them in my box.
Yeah, no, I want to hear.
Yeah. So, a lot of our favorite brands have these forever chemicals. And if you're sweating, your pores are open and you're absorbing.
Oh,
so you want to, like, All Wear is organic. I do a lot of organic cotton, organic bamboo, which is awesome because it's a really nice renewable resource that does absorb a lot of CO2.
Okay.
So if you're into the whole how do I reduce my carbon footprint thing, that's a good way to go.
That's the Cozy Earth sheets that I'm obsessed with too.
There you
bamboo.
Go. I'm wearing Caraloha socks today. There you go. I know. And then your underwear. Okay, that's big. Your mucous membranes, which is what your lady area is, are highly absorbent. Highly absorbent. So that also not just means your underwear, but your feminine hygiene products.
Yes.
You want unbleached, organically processed feminine hygiene products. So we use a lot of Cora, a honey pot at our house. Okay. Even silicone cups, which my daughters won't use, but those are an option that wouldn't leach into your body the same way as like traditional brands do.
Sure.
And then
interesting.
I know I've spent a lot of time on this, so
but I feel like this is what people want to know.
Yeah,
right.
I think so. How do we reduce this risk?
I didn't know.
Yeah. We use a lot of, again, I use kind of a tallow moisturizer on my skin. I still use some traditional lines.
Okay, so if people don't know, tallow is essentially from animals, right?
You got it. So one of the things,
say what that is.
Yeah. So one of the things that we're finding is that our regular meats at the grocery store are grain-fed, grain-finished, right? So that changes the makeup of the meats that we're eating. It makes them more inflammatory, interestingly. Okay. So it's higher in inflammatory fatty acids if it is grain-fed, grain-finished. If you want a higher ratio of anti-inflammatory fatty acids, then you want grass-fed, grass-finished beef products as much as possible. Okay. So tallow is actually the fat from animals. Yeah. Cows, particularly. You render it multiple times so that clarifies the fat. You get this really pure product. Okay. And then you can alter the scent and things like that using essential oils. One of the things you got to think about is that part of the problem is the preservatives in our food, the preservatives in our skincare. And so if it can sit on your shelf for a year and not go bad, and it's a liquid format in particular, so lotions, serums, it has to have a preservative in it.
Interesting. So what would be the timeline if it doesn't have preservatives in it?
Usually 3 to 6 months, unless you're putting it in your freezer.
Oh.
Yeah. So tallow is completely organic. You want to get your tallow from grass-fed.
That's what I was gonna say. I feel like I've heard tallow a lot lately. Yeah. Where it is, a lot of people are getting into that, like kind of more organic, super clean. Yeah,
I was super
I just
weirded out by it.
What it could become.
Yeah.
Like, you know what I'm saying? Because when you think of like tallow is like animal fat or whatever, right? Isn't that what you said? It's animal fat.
It is.
Yeah. I mean, you think like, I'm not gonna put animal fat on
super
my body.
Gross. Well, the first time I heard it, I was like, what are these
what are you
crazy
talking
people
about?
doing?
Yes. Yeah.
But then I'm like, well, let's dive into the data behind it. Yeah. Turns out it's super high in vitamin A, C, D, E, all anti-inflammatory. Okay. It has omega fatty acids that are anti-inflammatory as well. Wow. So it's helping to nourish your skin. It helps to heal the barriers between the skin cells. So
Okay.
we're talking about like your skin has ceramides, cholesterol, and lipids in it. And as the weather changes, as it gets bombarded by pollution, as we're scrubbing it with aggressive skincare, those little barriers break down and make you more susceptible to damage from, toxins and UV radiation and all kinds of things. And the tallow actually is kind of healing. So, but most importantly, in my mind, when you're buying it from a trusted resource, it also comes without the preservatives.
Sure.
So you're minimizing some of the toxins.
Yeah. Which, if you think about like a face cream, you go through a face cream in a month.
Yeah.
Right? Or 2 months, depending on like how often you're using it. So that seems very feasible to be able to use something that doesn't expire after that. It's more so because of what we're buying is sitting on a shelf in a huge warehouse until you click order.
Are ready to purchase.
And then it's, okay.
Yeah, well, and to be fair, I'm not totally organic, right? Like,
sure.
I like my retinols.
Yes.
So I do carry those. There are some skincare lines that are a bit more organic than others. So there's one that we don't carry yet, but is an oil-based cleanser, which is wonderful for maintaining those barriers, particularly in the winter in Utah.
Yeah. And I'm so dry.
Yeah, I am too. I use a triple lipid, moisturizer when I'm not. And the tallow actually works better than the triple lipid, by the way. And I've done both. I love both. But there's one called Epicutis, which is kind of new on the market, and they are an oil-based cleanser and a wonderful moisturizer. The only thing that I would say is if you're using those kinds of things, you do occasionally want some kind of an organic scrub to help remove dead skin cells and turn things over.
Yeah, because it's like a thicker feeling, maybe because it's oil based.
Yeah, so instead of getting like the alpha hydroxy acids that you might get in like a different type of face wash that removes some of the dead cells on the top of the skin, you're protecting that barrier, but you do need to turn the cells over.
Okay,
so I'm a fan.
Interesting. Yeah.
I also like things that come in a serum format because you know exactly what you're getting in that product. So I like SkinCeuticals. I like their vitamin C serums because I know what's in them.
Yeah.
There's a couple of other companies like that. And then the other thing, here's the most interesting one, and it's probably the hardest one to do, ladies. Are you ready? There have been studies that show that even during cancer treatment, exercising at least between 3 to 4 hours a day. Not a day, excuse me.
Oh,
a week.
I was like, a day?
Not happening now. No, a week. So that's like 30 to 45 minutes.
Yes.
3 to 4 times a week.
Yes.
Decreases all-cause mortality by up to 50%. And that's during cancer treatment, okay? Like
50%? That is staggering.
It is. Our bodies are made to move. And we live in these insulated little bubbles, aka our homes.
Yeah.
Our feet are never touching the earth, which, by the way, the NIH has its own web page on the importance of being connected to the earth. It's called grounding. It sounds very hippie.
Nope, I've totally heard of it.
But there's legit scientific white paper data.
Interesting.
It's so clear that even the NIH has its own little webpage on it. So get outside.
50%. 50%. That is literally staggering.
Yes, up to 50%.
I mean, I've talked on the podcast multiple times. I would call myself a lazy worker outer, but I do that 12-3-30, where I do a 12 incline on 3 miles per hour for 30 minutes is what it is, but I actually do it for 60 minutes. So I do an hour every day. But I typically, even just doing that, which feels very low key to me,
that's what
I
it
walk
takes.
3.1 miles every day.
Yes. Our bodies, we know that magic number is 10,000 steps a day.
Yes.
Right? The average person is around 3,000 or 3,500 steps a day. So you guys, our muscles are amazing. And it serves twofold. The purpose is twofold here. Yeah. When we exercise, our muscles help to turn over blood flow. It helps to detoxify. Your lymphatic system picks up. You're moving all of the fluids in your body that when they become stagnant, no longer carry toxins out of your body.
Okay.
Right? Then when you're exercising, you sweat. There are
also
3 ways that your body can get rid of toxins. It's through your digestive system.
Okay.
Through your urinary system.
Oh.
Right, of course. Of course. And then sweating.
Yeah.
So if we are sweating, I'm not even talking like heavy sweating, but let's say you're getting your blood flowing.
Yeah.
You sit in a sauna, you get outside and you walk in the sunlight, and that beautiful infrared that comes from our sunlight helps to warm you up. those things are going to help you sweat and detoxify your body, right?
Yeah.
So we get all these toxins through our routines. You guys,
Wow, yeah.
I'm telling you,
I'm literally still shocked over the 50% number.
And that's if you are in the
Yeah.
middle of cancer treatment,
Yes.
right? Like your risks.
Well, don't you feel like we grew up though in a time where like working out wasn't like big?
No.
Like my parents never worked out
No.
until way later, like in life.
But
like
I also feel like when we were growing up, it was people were not as stagnant as we are now.
Oh, absolutely. Because people were doing gardens and
absolutely.
Yeah, for
they
sure.
were touching the earth. They were digging in the dirt. They were expanding their microbiome, which we know is critical to our well-being now.
Yeah. Yeah.
And the more data that comes out with that, the crazier it seems that we interact with the world the way we do. You know, we get a cold and we think it's a sinus infection. And to be fair, that's a good time to use an antibiotic. But the more we use antibiotics, the more that alters our microbiome.
Sure.
There's a study that came out that said one round of antibiotics will increase your risk of depression by 25%. 2 takes it up to 60 in a year.
Oh my gosh.
Okay, so we know that these things impact us, right? They're part of our serotonin, which is part of our feel-good hormone.
Yes.
It helps to regulate that. It's part of our hunger feedback mechanism, the type of bacteria we grow in our gut. So these are things. So what I can say is
just because antibiotics wipe out your good gut stuff, right?
It changes our microbiome, the bacteria that we carry inside and outside of our body.
Okay.
And then we have to work to rebuild that.
Sure.
And so I take a probiotic. I put patients on antibiotics. There is absolutely a time and a place for them. So please do not think that I'm saying don't take them.
Yeah, yeah.
But I tell them, please take a probiotic. Mm-hmm. Here are a couple that I recommend. Weirdly enough, doTERRA has a rockin' probiotic. Oh. I love it. I love their PB Restore.
What? Yeah. What is it, like a pill form?
It's a pill.
Oil? What?
It's both. It's a dual encapsulated chamber. So the outer part of the pill dissolves in the stomach, and the second part where the spore-forming bacillus get into the gut is in the second part of the chamber, the inside.
Interesting. Okay.
So they have a PB Assist and a PB Restore. We carry both at my office. Cool. I love them. But if you're like, hey, MLM is a bad word, by the way. I think MLM is a bad word. So one of the reasons I even hate mentioning the word doTERRA is because I literally don't love their business model.
Yeah.
But then there's another brand on Amazon called Ion Gut Health. It's a liquid.
Yes, I've heard of it. Mm-hmm. Okay.
And
you literally just take a spoonful.
Yeah.
Right?
But don't put it in tap water because tap water is chlorinated.
Okay.
And one of the few things that will kill that spore is chlorine. Yeah. So take it in something else. Take it in apple juice. Oh,
like, wait, you have to like mix it into something?
You don't have to. You can just take a teaspoon.
Okay, that's what I was going to say. I'm like, I thought at least the ones that I've seen, it is like you just literally just take it down.
To be fair, kind of grosses me out because I'm like, I just swallowed bacteria. Like the idea of it.
Yeah.
I know, it's super weird, but it's one of those things where
be so gross.
It's kind of a weird mental.
For sure.
But that's another good one because it is a spore-forming bacteria. You need the bacteria to be able to tolerate the stomach acid and get into the gut. So it has to be a spore former or dual encapsulated.
Okay.
Yeah.
And guys, this is all stuff that I'm going to link. I'll have you just send me whatever.
I can send you stuff,
And then I will just post this because everyone needs to know this information.
Yeah, I'll send you.
So do you take the probiotic literally every day?
Oh, I do every day.
The probiotic. It's just like a part of
your life. It's part of my day.
Okay.
It's part of my day. And it's changed how I feel. There are other things that I do for personal health and well-being that also have been shown to potentially help with reducing inflammation. And inflammation tends to be a root cause for chronic disease, illness, and cancer.
Okay.
So things that I do I do a couple of times a week, but not every day, is things like intermittent fasting.
Sure.
And where I do 16 hours of fasting. So that's usually 8 p.m. to noon for me.
Okay.
And then I eat whatever I feel like eating between noon and 8.
Yeah.
But I do those hours because...
You only do it like a couple days a week, not every single day.
It's not every day. I can't.
I used to do intermittent fasting every day, and I just don't feel like it did much for me.
Yeah, my big thing is you don't want your surgeon walking into your surgery hungry. So I don't fast on operating days.
Sure.
Which is at least 3 days a week for me.
Yes. And you do have long surgery days.
Mm-hmm. The other thing is, we're not perfect, right? Yeah. So I was telling Courtney, one of the reasons we're a little bit slow getting this recorded today, which you won't know because she's going to post it, but I was like an hour late.
It's all right. It's all right.
Is because like twice a year on our...
You're so funny that it's only twice a year because
we're picky,
Yes,
right?
yes,
But
yes.
we do conference because we are Utah County type folks,
Yes,
and
we are.
this is conference weekend for us
Yep.
right now.
Yes.
So twice a year, my kids get donuts, and so I had to go pick up daylight donuts this
So that
morning.
you really, they don't have donuts any other time besides like
If somebody
twice a
brings
year?
them,
Sure, but
then
that's not something you guys are like going and buying.
no. But we do.
I feel like I just don't go buy them because then I know they're here.
And
like
then I eat 'em.
eat that.
Yeah,
Exactly.
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 But we also try to, the things that I teach patients, one of the things that I think is important is that I'm not, I'm never going to be perfect at these things.
Sure. Absolutely.
But I'm not telling people to do things. And I think this is important about leadership. I do this with my staff. I don't tell people to do things that I'm not willing to do myself.
Totally.
So like if I have, a surgery in my office, I'm cleaning up the room with them.
Yeah.
Because I'm not saying, hey, you go do this while I go do the fun stuff.
Yeah, totally.
Like as a leader, as a person who's teaching health and wellness, I have to do what I preach.
Yeah, for sure.
So for us, we do things that we've changed. We read the labels on everything we buy.
Okay.
We try to purchase organic when we can afford it, and when we can get a hold of it.
Yeah.
And to be fair, it's more costly, right? I have 5 kids. Even as a plastic surgeon, it's expensive.
Yeah.
We do sourdough.
Yep.
I bake my own bread, and I didn't grow up cooking. I grew up really poor. We ate ramen and we ate mac and cheese, and that's what I grew up on because we couldn't afford much else.
Yeah.
And so this is a big thing for me. I don't like to cook. I don't like cooking daily meals. It's stressful because it reminds me of when I didn't have enough food to cook for my siblings when I was younger. It was stressful. And so
and I just hate it because I freaking hate it.
Well, and maybe that's part of it too, to be fair.
There's no other reason besides the fact that I do not want to do it.
Yeah. And that and you're like, here are these cookbooks. And I'm like,
yes. Well, because I feel like I have to. Like,
like see if you can find an easy source.
And that is where, and I feel like they're good things, right? Where like, again, it's not just from a box. It's like,
I'm going to make these things.
Yeah, you're still making it. It's ingredients.
And I'm totally buying your ranch. Because I don't like ranch because of what's in it.
Yes.
I'm buying this.
Yes. Well, when we walk out, I'll have to show you the little thing and just see. Because it's, I mean, like, Shelly across the street, like I got her hooked on it. Now her mom and her sisters buy them. Like it really is so good.
Awesome.
So good.
So what I say is we do these things. We drink filtered water. Okay. So we have a filter on our house.
Mm-hmm. Is it just like through your fridge or literally like on the
whole
water?
House. Okay. Because you're showering in it.
Yeah.
Your kids are sitting in the bathtub drinking. Nobody else's kids do this, I know, just mine. But I'll look at them like, why is your face in the bathtub?
No, they all do.
Gosh. Yeah.
But also, it's funny that you mentioned that just for your whole body because that is what like can tarnish hair color. Tarnish maybe is not the right word, but like it can make it go a different color.
Yeah,
it can alter it. Yes. Yeah. Like filter, a lot of times people have to put a certain filter on their showers
so
heads. That it does not. And because like there's minerals that get into, like I've colored people's hair where I open up the foil and there are like spots.
Oh.
Because there is calcium buildup on their hair. Yeah.
Yeah.
I think it's across the board, just a good practice.
Yeah.
If
and
you
don't have to filter your whole house, right?
Sure.
The shower filters are not that expensive.
No, they're not.
So throw a filter on your shower if you're worried.
Sure.
Or, again, you could put they make excellent filters that just go into your kitchen sink and just make that your primary source of where you get your water to drink. And, brushing your teeth, you're not getting that much water.
Yeah, sure.
Right. But I'm a big advocate of filter what you can and just reduce some of the stuff we're exposed to. And again, it's what can you do within reason?
Sure.
This should not alter your joy in life.
Yeah. It shouldn't like take over your life and also like be at a detriment to your income as well.
Oh
where
gosh,
it's like you were saying, like buy organic if you can, if you can afford it.
Yeah.
Sometimes it's hard for me because when I'm at the grocery store, it's like, okay, do I get the organic bananas or the regular bananas? And I'm like,
I don't know if bananas make a difference.
Yeah, that's what I'm saying. I'm like, I don't even know what things make a difference and what don't. So I tend to just err on the side of like, well, this is way cheaper, sometimes by 50%.
Yeah.
And so I'm just going to go with that.
There are a few tricks for that.
Okay.
So you can Google the Dirty Dozen.
Okay.
And that will give you the list of the 12 fruits and vegetables that you want to try to buy organically.
Oh, interesting. Okay.
And think about this, like how easy is it to buy, to tomatoes in Utah will grow like a weed.
Oh my gosh, yes.
Nothing grew in our garden this year except we got cantaloupe of all things. But
random.
Super random.
Yeah.
But then tomatoes and peppers. And those are the only things that I successfully did not kill this year. So
I feel like I've always been able to grow tomatoes.
Tomatoes,
but not peppers. I've never been able to grow
our peppers grew, and they're so spicy. I don't know what we're going to do with them. But they did
so
grow.
they're not like just regular green peppers?
So the bell peppers grew. We got a couple of those, but they were supposed to be salsa peppers.
Oh, sure.
So they're not supposed to be super spicy, but I think they got too much sun, like they were too hot in the sunlight. And sometimes if they're too dry, meaning they don't get enough, like radishes are more spicy if they're not watered enough.
Oh.
And who knew, you guys, these are all things I've learned in the past 3 years.
I know, I was just
in case anyone's wondering.
We also, guys, I talk a lot about like the chickens and gardening and my flowers and stuff.
My chickens are her fault.
This. Yeah, I know.
Absolutely her fault.
My Easter eggers finally started laying their green eggs this week. I know. So excited. Not the blue ones yet, but
they're every other day anyway.
But yes, we love to talk this kind of stuff too.
So, if you have the opportunity, and like usually cucumber plant, I've never been able to successfully grow a cucumber plant. That's because my dogs eat the vines.
Yes.
But cucumbers are supposed to produce prolifically during the summer here. Yeah. So if you have the opportunity, it does not take that much effort to grow some of these things.
And that is cheap. And you don't even have to have that big of a space. That's where I think a lot of people are like, oh, I can't do that. I'm like, no, you really could have like
a gigantic pot
bucket
on your
or something.
Yeah.
Yes. Yeah, for sure.
And that's one way where you're not having to like
question the
what's on it,
stuff.
right? You take it inside, rinse it off, you're done.
Yep, totally.
Then there are some different types of things that will remove. If you're not doing that, you can do, I think it's a combination of baking. There was one other item and I'm not thinking of it. Baking soda is one because pesticides tend to be a little bit on the acidic side.
Sure.
So it's like water, a tablespoon of baking soda. I don't know, Google it, you'll be able to find it.
Sure.
That will help to remove a lot of the pesticides and reduce what you're getting exposed to.
Oh, okay.
So you can Google the Dirty Dozen.
Like clean. You're saying like clean the stuff that you're getting
apples,
from. Yes. And I know that I think even Trader Joe's has like a mix type thing that you just put like a tablespoon or something in your water and let it soak for 10 to 15 minutes. Put your strawberries in it
or whatever. Yeah. Strawberries tend to be one of those foods that contain a little bit more of the pesticides and things like that. So throw those in there.
See, I'm not good at that because I'm like, I want to eat it right now. So I'm like, let's hurry and wash it off, Yeah. But I do need to be better at that for sure.
And you're just looking at little things.
Yes. Oh yeah. Totally.
That's kind of what I think.
Yeah. No, and I think that's all good things because that was kind of my follow-up question to that too is, do you think changing your diet? So would you go into even like the dyes, like the red dyes and like all of that? Because I have a friend who her son had cancer. I don't even remember what kind. This was years ago. He survived, but even now he's still having a lot of issues from chemo and stuff. Yeah. But she like changed all of that.
Yeah.
Like the dyes in their food. Like she has just done research after research after research about all of that.
Yeah. So let's talk about dyes
for
just a moment.
After I just said nerd gummy clusters are my favorite thing.
I'm telling you.
I know.
Perfection is not the goal.
Yes. It's just better today than you were yesterday.
Exactly.
Sure.
So, dyes. You guys, in the United States, dyes that are banned in other countries are in almost everything we eat. Okay. Here's what's interesting. Kellogg's makes Trix or Lucky Charms, right?
Yeah.
They make a different type of cereal for the United States than the one they send to Canada. They use Red 40, which in some European countries where it's not banned, it may not be banned, but you have to have a label of warning on the boxes. And it will say, red number 40 is in this. You may notice a change in your child's behavior with symptoms akin to ADHD. Guys, this isn't everything, and it's not illegal in the United States. What they send to Canada is dyed with beet juice, with turmeric, with all kinds of things.
All natural stuff.
So they make one type of cereal that they send to these countries, and then they feed our kids these dyes. And when you ask them why, they say that Americans prefer the brighter colors in the food. And my question is,
have to do with anything?
Did they ask me if I would rather have a toxic food dye that alters the way my child behaves versus a slightly grayer? And what they say is that the ones that are not dyed with these synthetic dyes look more gray. And my thought is, if it's going to keep my kids healthier, I don't
Who
care.
cares? Because we're chewing it up and swallowing it anyway.
Exactly. And so my response to dyes is, we know dyes are derived from petroleum byproducts. They were not meant for human consumption.
Yeah.
We know yellow number 5 increases your risk of testicular cancer, and that's in Mountain Dew. It's in all kinds of things. Your orange sodas. Yeah. We went to Europe for the first time this year, and we got Fanta. So in Europe, Fanta is 20% juice with no artificial colors. We were like, that's healthier for you than drinking orange juice in the United States. Sure, have a Fanta for breakfast.
Yeah.
It was wild because those things are banned in other countries, but they're in everything here. So if you're wondering, even in our bread, here's why I decided to learn how to bake bread, which, by the way, was one of the hardest things I'm a plastic surgeon, and baking bread has been my Everest. The reason we decided that was worth the battle is when I was picking up even my favorite types, the brands of bread that I trusted, they have plasticizers in those bread. So what does that mean? The way that we make bread rise is usually either from a sourdough start, right, which kind of ferments and causes bubbling.
Sure.
Or it's yeast, which ferments and causes bubbling.
Yeah.
The way you make that happen quickly, rather than having to wait for that 8 to 24 hours or whatever it is. Some sourdough recipes are like 2 days. I'm not that cool, you guys.
Yeah.
Is they use the same stuff that you put into styrofoam to make it bubble and make it light. They use that to cause bread to rise. I'm not kidding. I didn't believe it. I did not believe it when I first heard it. Then I started going to the store and looking at the bags, and I was like,
that's wild.
It's really in there, and I'm giving this to my children. I'm literally poisoning my kids. Right? And it made me feel crazy. Like, these things sound wild when you've grown up eating these things.
Yeah.
But the things that we eat now are not the same as they were in the 1980s. Well,
because it blows my mind that there's companies that are even putting stuff out there like that. I would say 90% of what I eat is probably like that, besides my Clean Simple Eats protein.
Yep. I love Just Ingredients.
Yeah, Just Ingredients is the same. Yep. Yeah.
So
that is crazy.
It is crazy. And so we started just trying to see if we could make some of these things.
Sure.
And let me tell you, we've had some rockin' disasters.
Yeah.
And it's been a lot of fun.
Would be right up my alley.
Yeah. And it's been a lot of fun. I mean, like I said, I don't love cooking.
Yeah.
But I do enjoy being in the kitchen with my husband while we mess things up. I mean, it's really fun because it's humorous, right?
Yeah,
and
totally.
So we get to sit together and work together. And now he's better at baking bread than I am, which is not a hard thing to do. But it's just little things at a time. Like, we've made pasta, and we've had one really great batch, and we've had some really bad batches, and things like that.
Like, you're taking like the flour with the egg in the middle and like mixing it up.
Well,
like
I don't know about the egg in the middle thing, but yes, that's what we're doing. Okay. So I'm not really great at following instructions, which may be why things don't
I've never done it at all.
It's not hard.
Just because we've watched shows like Beat Bobby Flay or like any of that, those cooking shows that they do homemade, and it's like, no, it's really not rocket science. No. It's just usually like a type of flour, and yes, it just takes so much longer, which for me, I feel like I don't have that kind of time.
And that's true, right? We're so busy that it's hard to find that time. But like the bread, we'll bake 2 or 3 loaves at the beginning of the week. Yeah. Freeze 2 of them. Then we put one in our little wax covered bee bag. So it's a fabric bag with beeswax on it that keeps the bread from molding, but it keeps it moist. Yeah. And then by the end of the week, we've gone through all 3 loaves. Okay. And before I started baking bread, we didn't even really eat that much of it. I just didn't want that stuff in the house. Totally. And so now my kids are like, and they call it mom bread, which is the funniest thing. I'm like, I guess it's,
thanks.
They're like, I'm like, yes, mom bread.
Mom bread, yeah.
I'm like,
I made it. Thank you.
But now they're like, we want mom bread for breakfast. And we make, now, like I have a patient that has an orchard.
Eat like peanut butter and jelly on it? Or what are they eating for like lunch? Okay, my kids will literally, Dylan will come home and sit down and eat 4 peanut butter jelly sandwiches.
Yeah, so some of my kids like peanut butter, some of them don't. We have some picky eaters.
I don't like peanut butter.
Yeah, and so some of them like honey, which I've kind of like forced onto them because I'm like, here's a sweetener
Yes.
It's a little bit better, and we love like Utah made honey. There's a ton of beekeepers in
tons.
Utah.
We even have some here in our neighborhood.
We have bees, but they've never produced honey, just so you know. I'll tell you why another time.
Yeah.
But we've got fun stories with the bees. But so we get honey. So some of our kids like honey and cinnamon on it, and it tastes like Cinnamon Toast Crunch.
Yeah.
Right? Like we want cinnamon toast for breakfast.
Yeah, for sure.
I make peach jam or strawberry jam.
Love. Yep.
Or, we grow, like, strawberries are great because they come back every year. So this is not rocket science.
We do that too. Yep.
Yeah. And then you get like this one time where there's this big boom and I'm like, oh, I can freeze these or I can just make jam.
Yeah.
So we do that. And they'll eat that on it. But mostly they do eggs on them. So we'll do toast and eggs.
I love egg on toast. Yeah.
Yeah.
Or like avocado toast.
Yes.
We do love to do. Because we actually love sourdough bread for grilled cheese sandwiches too.
Yes. Yeah. We do a lot of grilled cheese.
Yeah.
And there's a place in Spanish Fork, I think Abby's. Is it Abby's? Ooh. I can't remember. Abigail's. No. I can't remember. They do like legit sourdough using the cast iron en masse. And it's a big deal apparently. And I've had it once or twice. Like a patient will bring it into the office for the staff.
Sure.
And you're like, this is awesome.
Okay, I'll have to look.
So that's a good one to look
local,
up.
For sure.
Spanish Fork. Anything again, and we're really big into supporting local companies.
Yes.
So if you've got a local company and you want us to showcase, let me know.
Yeah. Oh man, that's fascinating. Yeah, that's like so many things and I think that's where even when I told you before we started, like I was asking a friend, like, hey, what are some things that you would want to know? And a lot of that was the questions of, what in our diet is changing that and how can we prevent? And so essentially that's all encompassing with what we just talked about, right?
Yeah.
Like changing these things will prevent.
Yeah. Don't store your food in plastics. Try to get glass. It's reusable, lasts forever that way.
Yeah, for sure.
But plastics tend to leach and plastics have forever chemicals in it.
Interesting.
So just like the plastic type clothing that we're talking about, you want to minimize how much plastic you're using. It's better for the environment. It's better for your kids. Wow. You want things.
I would never even think about clothing as like
a major source. Yeah. I'll send you, I'm not mentioning brands because
sure.
I don't want to villainize anybody, but I'll send you a list of things that like my kids love the brands. And I've just told them we have to, and we're replacing a little bit at a time because again, it's expensive to buy that clothing and it's expensive to replace it.
And then to replace your entire wardrobe is not,
So there's a few clothing companies that I do love.
Okay.
So the all wear is what I'm going to be replacing our workout clothing with.
Yep.
I love Packed. Packed clothing is organic. They worry about their carbon footprint. So again, if you're into this, that's a good clothing company.
How do you spell that?
PACT.
Packed. Okay.
Yeah. We should call them. You should try them. They
sponsor me.
Yeah. I wore them. I wear their clothing. They do organic linens. I wore them all through our trip to Europe that we took this last year.
Yeah.
So any photos you see, I'm pretty much all in Packed. It's awesome.
Cool.
They have underwear for girls and boxers for boys. Yeah. So I love them. I do a lot of Quince. Quince has organic options on there. Quince is less expensive than some of those major brands. I love major brands, but I don't want to pay those prices.
Yeah.
So Quince is direct to consumer and they're awesome. And then I tend to look for things that are bamboo fibers.
Okay.
I tend to look for things that are organic cotton. And then I look for brands that advertise the fact that they know what PFAS is. PFAS chemicals are.
Sure.
And so you want to see that their clothing, your perfumes, whatever it is, are PFAS free.
Okay.
Forever chemicals are chemicals that don't leave the body. So over time they accumulate.
That's why it's literally called forever.
Yes. So you want to minimize those things. So you want to minimize your plastic.
Man.
You want to minimize what you're putting on your kids.
Yeah.
And, for me, it's kids first. And then I try to find more organic skincare, shampoos, body washes, things like that.
Yeah, for sure. So. And I think too, like you were saying, don't get overwhelmed by this.
No.
Just do a little better tomorrow than you did yesterday.
We literally started by buying one ceramic coated pan.
Yes.
And then I was like, okay, so if this is the one that we use the most, then, and we used to have this square pan and we cooked all of our pancakes on it and it had Teflon coating on it because it was nonstick. And so I told Jason, we use that pan almost every day. Why don't we switch that one?
Okay.
So we started with one pan and we got it at Shabundi's, guys. They have
Oh,
ceramic coated
yes.
Shabundis at
Yeah.
like a quarter of the cost. Okay?
Yes.
This does not have to break the bank.
Yeah.
So slowly
way
start
to
to
do
turn
it.
over your cups. We got stainless steel cups on Amazon for the kids. Now the kids are older. We break a glass or two, but we use glass and
Yeah,
stainless
we
steel.
do. I mean, we've used glass forever. We've actually used mason jars.
Yeah.
That's what we had used
Plus
as
it's
cups
cute,
for years and years.
right? We
Yeah.
look you feel all organic and homey, and you're
Yeah.
using your so things like that does not have to be expensive. But
Yeah,
literally,
that's
we
smart.
started with. I was like, Jason, I heard that this coating. That's my husband. This coating on the pans is bad.
Yeah.
So why don't we just get rid of the one pan that we use the most and replace it with one?
Yeah.
And it was literally at Shabundi's. I was like, I found the pan and it's $25. This
Yes,
is it.
like, this is
like
it.
we're good.
This is changing. Yeah.
Yep.
Yeah.
One
No,
pan at a
I
time,
think that's
guys.
fantastic. One
That's
pan
all
at a
you got to
time.
do.
It's going to be a great quote for this podcast episode. One pan at a time.
You can do this, and it's just little
Yeah.
changes.
Yeah.
Right. It's never going to be 100%. We live in a world that's full of constantly evolving desires, needs, wants, and people are trying to find creative ways to fill that. And then we learn that something that we're doing maybe isn't the best, and then we make a change.
Yeah.
Right.
For sure.
So one thing at a time.
Okay. No, I love that. Okay, so then to kind of finish up, what do you love about working with breast cancer patients? I mean, I'm sure there's a million things, but I do feel like if I can,
I might get emotional.
that's okay. That's okay. I feel very lucky, like I said multiple times, that just the people in my life that I get to be around, even just as being their hairstylist. I can't even imagine being their doctor and going through that, like I said, with them. Even though it's not a bad trauma, it's still something that bonds you together because you were with them in one of the hardest parts of their entire life.
Yeah.
So what would be something that you carry with you after every single patient?
So it's funny because I a lot of times actually lose money taking care of breast cancer patients. Yeah. And so I get a lot of the time, Elise, you're so good at what you do, just stop doing the insurance stuff.
Yeah.
And that's never going to happen because it is such a privilege.
Yeah.
To be there with these women at one of the hardest experiences of their lives and to see, and I don't even know how to describe it, I guess, but to see these women not just overcome, but thrive.
Sure.
Right. See them grapple with, cancer takes everything. It takes our identity as women.
Mm-hmm.
It takes our health. It takes our mental acuity and our focus. Chemotherapy impacts how sharply our minds focus, right? And how quickly they work. And you see these women faced with some of the hardest challenges they will ever go through, and then find a way through that and just thrive. You see women who are galvanized by these experiences, who create foundations, and you see women who go through them with this quiet inner strength that is literally awe-inspiring to me. And you see moments of weakness where there's just a breakdown, or you see somebody who gets a second round of a diagnosis and you're like, and excuse my language and you can edit this.
Yeah.
But this is just shit.
Yeah.
And you sit there with them and we swear a lot together.
Yeah.
Right? You're okay to swear in my office. We cry a lot together in
we
my
swear
office.
here too.
You can edit that.
Just no F word.
Yeah, no. And you can edit that. But it's just one of those things where my life is made richer. And what's amazing to me is that cancer is no respecter of persons.
Yeah.
Your socioeconomic status is not respected by cancer. The color of your skin is not respected by cancer. Your level of education is not respected by cancer, right? I have had tech company owners. I have had women without a high school diploma. I have had everything in between. Mothers, women who've never been mothers, who define themselves by completely different means, right?
Yeah.
And they are all extraordinary. And when they come into my office, those things don't matter. What matters is that we're finding a way through to rebuild and restore and redefine how we see ourselves as women. And the reality is, all of the things that we think define us they can change,
Yeah.
right? They can change.
Yeah.
Our bodies change, our children grow, our ability to have kids changes, right? Our desire to have kids is different, but you see this process of refining and redefinition, and it is extraordinary. And that is literally my purpose. And so I will never be your super rich plastic surgeon dancing on TikTok, but you will, as much as I can provide, you will always have real care, real treatment, real honesty. And I'm willing to go into whatever version of that conversation you need to go into. And that's what we provide. And it makes me a better doctor, a better mother, a better wife, more curious, more of a warrior. It's galvanized me to find answers that don't fit in the box, just like what drew me into microsurgery. Is my role is to find those answers that are not following the exact protocol or narrative. Even if it's uncomfortable, we're going to look at it and we're going to try to find the best solution we can find. And that's why I like taking care of those patients, because I'm inspired by them.
Yeah.
They're awesome. I've literally met the most extraordinary people ever through that one part of what I do.
Yeah.
It's awesome.
Which is so awesome. So awesome. And this is exactly why I wanted you to come on.
Thank
because
you.
I've been wanting you to come on. I told you that when I started it, but I was like, what avenue did I want to go down? But this was perfect. Like, I could not have asked for anything better. So thank you.
You're welcome.
As always. But hopefully you guys will join us again on Time to Process. I actually would love to have you on again at some point. Maybe we can talk. I don't even know what we'll talk about next time.
We can talk about all kinds of things.
We can even just talk about plastic surgery and all that kind of stuff. But yeah, Elise is definitely a wealth of knowledge, you guys. She also, if there's any questions that come in after listening to the podcast, please send me a DM. Yeah, send me a DM. We can go through them. I can send them to her. She'll get back to us. But to end this, I pray for those who are going through cancer right now, any type, not even just specifically breast cancer, but I pray for you. I pray for your families. And I pray for the doctors that are working with you, that they will think outside the box and that they will try something maybe different that is not, your typical, to be able to help you in any way possible. So anyway, thank you for coming again. I really appreciate it. We'll see you guys next time.